The 5th of July 2023 is the 75th anniversary of the NHS. To mark this special occasion, we've collected recordings of people from across the NHS in Cornwall. These voices share their memories, achievements and experiences. We begin our compilation with Dr. Alistair Slade, who's a cardiology consultant at the Royal Cornwall Hospital.
There have been enormous changes in the way in which heart patients are cared for since the formation of the NHS. Initially, people had to travel to London for all of their services, but in the 1970s and 80s, large district general hospitals began to appoint cardiologists who still had to perform general medical duties. In the 1990s, there was further expansion, and in Truro, this led to considerable repatriation of services from London under the auspices of myself and Dr. Trevor Johnston. These included diagnostic coronary angiography, complex pacing, and ultimately coronary angioplasty, culminating in the development of a primary angioplasty service in 2011. This model has now been widely accepted as the way in which cardiac services should be delivered in the 21st century. All things that can be done locally, safely, are now done for Cornish patients. And as we look forward, there may be further developments with keyhole valve replacement surgery on the horizon.
Hi, I'm Andy Sant. I'm a GP and I specialise in looking after elderly care, particularly in the inpatient environments in our community hospitals in Cornwall. I also have a role on the Integrated Care Board. A moment in my NHS career that sticks in my mind revolves around the end-of-life care. When you work in elderly care, we're often dealing with people who approach the end of their life, and we have to have conversations about what does good death look like, how would you like to be supported, how would you like to be looked after. And I'm particularly struck by a lady who we sat as a team with her family and helped her through the end of her life by being there and being comfortable with her, sat on the ward with those who loved her around her to have the best possible death.
My name's Annie and I worked for the NHS for 40 years. I was the medical secretary, mainly in obstetrics and gynecology. I think the proudest time was that time I worked during obs and gynae because I just felt like I could make a difference for a patient every single day, really. Just seeing the journey for a patient from start to finish when they were first referred, whether it was either for fertility treatment or for menopause treatment or cancer treatment, just see it through from start to finish.
Hello, I'm Dr. Celise McDermott. I'm a psychiatrist working for CFT. I love working in the NHS. It feels like part of my family. I've done so for over 25 years.
Hi, I'm Chris Reid. I'm a GP and I'm the Chief Medical Officer for Cornwall and the Isles of Scilly Integrated Care Board. I think my fondest memory of the NHS that to me shows the importance of it was my mum. She had early onset dementia and the care that she received, and moreover the care that my father received in how he cared for her over the last few years of her life was incredible, and it supported my father as much as my mum.
Hello, my name is Debbie Richards. I'm the Chief Executive of Cornwall Partnership Foundation Trust. I'm proud to be Chief Executive of this trust. We provide mental health and community services across Cornwall and the Isles of Scilly. I'm particularly proud because my mother began her nurse training in one of our community hospitals aged 16. Not only did she demonstrate to me that the NHS is more than a lifelong commitment, it is also for a number of us a family commitment. I'm most grateful to my mother and her sisters, who also began their nursing careers in Cornwall. I'm grateful for their inspiration, their pride in nursing, but most importantly, instilling a value in me of the NHS and the public service that we provide.
I'm Helen and I'm one of the acute oncology nurse specialists here at Trelisk. Fond memory of working in the NHS. All I've done is cancer services and I'm very proud to be a cancer nurse here at Trelisk. We've now got a brand new haematology oncology day assessment unit which is just opening, and I'm excited to see what this brings for our patients here in Cornwall.
So I'm John Gavett. I chair the Integrated Care Board for Cornwall and the Isles of Scilly. I'm so proud of the NHS. For a personal reason, more than anything else, my wife wouldn't be alive today without its help. Thank you, the NHS.
Hello, I'm Karen King. I'm Senior Staff Nurse and I am most proud to work for the NHS, particularly in this environment I work in because we support students here. We do collaborative learning with them and they often develop on to become nurses and they may come back and work with us. And we found that we get a lot of positive feedback from the nurses, students working together and participating in MDTs and just working together and building confidence with each other and then seeing them develop and grow into brilliant staff nurses.
Hi, I'm Kate Shields and I'm the Chief Exec of Cornwall and the Isles of Scilly Integrated Care Board. What does the NHS being 75 mean to me? Well, I was a nurse. I never thought I would be a nurse. It was definitely something I was never going to do because my mum was one. But I worked as a nursing assistant on the care of the elderly ward with women who had dementia and I absolutely loved it. It's been a big part of my life and I feel very proud to have contributed to some amazing care over the 38 odd years that I've been working in the NHS.
Hi, I'm Kathy. I'm the Cornwall Foundation Trust Chaplain. The thing I love about the NHS is that when my husband was 11, he was told he wasn't going to live past the age of 18. Instead, thanks to the NHS, he lived long enough to meet me and marry me. And when he died, the NHS fought tooth and nail to save him. With his last thought, before they anaesthetised him to try and save his life in a theatre, he thanked the surgeons and said, "Thank you, as part of the NHS, for all the extra time you have bought me."
I'm Ken Bishop and I'm a staff nurse in Helston Community Hospital. One of the proudest moments is working as part of a team and you're very close to your team members, so all your members are, they all know what they're doing and they all have a heightened state of teamwork. So we back each other up, we look after each other, but we are there to deliver the best possible care to our patients who come in with absolutely anything. So on the day you don't know what you're going to get.
So I'm Leslie Beresford and I've worked for the NHS for 53 years and at present my role is a continuing healthcare assessor. Throughout my years working as a mental health nurse, I've worked with many people and as a mental health nurse the only toolkit that you have is yourself to get to have a good relationship, good rapport with people. And one very special moment to me that happened only just 2 or 3 years ago. I was walking in Padstow and a lady and a man came towards me. We sort of recognised each other but couldn't remember where. And then the lady said to me, "Oh, Leslie, I remember you. 5 years ago you came to visit my mother. You helped my mother so much and we're so grateful for all you did. My mother used to really enjoy your visits." And that was an extremely rewarding moment to me. I don't really know what I did, but obviously I must have done something that touched their hearts and I found it so lovely that they were able to say that to me.
Hello, my name's Lisa Griffis. I'm a senior staff nurse on Lowen Ward at Royal Cornwall Hospital. I have been proudly working for the NHS since 1987. Things have changed a lot since I was a student. We used to wear frilly hats when I first qualified. The NHS is so much better now than it was then, and I love and am proud of where I work.
My name's Lucy Twoson. I'm Director of Engagement and Communications for the Integrated Care Board for Cornwall and the Isles of Scilly. So I've never worked for the NHS before, but it's been so welcoming and really friendly, and especially as I've been getting out and about to our communities, it just shows me how important the work of engagement is to shaping the future of NHS. And I've just been really lucky to meet so many great people, both as staff, but volunteers and the people that we are serving across Cornwall and the Isles of Scilly.
My name is Matt Overton and I'm the Emergency Planning Lead for Royal Cornwall Hospital's NHS Trust. My main memory from my time in the NHS, which started in 1997, is attending an incident on the ward in my emergency planning role and helping patients where I'd been a patient myself as an 11-year-old. The ward was completely unchanged except maybe a coat of paint in the intervening years.
I'm Nikki Hughes and I've worked in the NHS for 34 years. Currently I am Head of Planned Care Commissioning, which means for every operation, every diagnostic test, every outpatient goes through me and my team, so the whole of Cornwall and the Isles of Scilly. Oh, in the 34 years I've been really privileged to have done so many things. The one that sticks out the most is setting up a new nationally recognised service for epidermolysis bullosa, and that would have been the first specialist centre outside of London for adults with that condition.
I'm called Pearl Vidler and I've worked for the NHS 18 years as a healthcare. Palliative care, I've been doing that for many years and we've had a few patients. This lady was in at July and she loved Christmas, so I brought a Christmas tree in and we decorated the room and all up for her and she was so grateful. She was very young as well, so it was very sad.
Hi, I'm Rachel Crocker. I am an acute oncology clinical nurse specialist here at Trelisk Hospital. A fond memory I have of the NHS is being able to work within an emergency department, and now in the role I am, I'm helping to support our patients to stay out of hospital and get them home without needing admission to hospital.
So I'm Rita McNairy, worked in the NHS for the last 44 years. I'm a clinical manager at the ECT department at the moment. I love the NHS because I'm very dedicated to helping people to get better and recover from their difficulties, illness, trauma, and I get a lot of satisfaction out of seeing that happen.
My name is Sarah Caskey and I'm matron for cancer services at the Royal Cornwall Hospital. I've been working in the NHS for 32 years and I'm really proud to be part of an institution that's been long-standing and here to the next 75 years.
Sharon Hambly, speech and language technician with the Adult Learning Disability team. I started my post in 1997. I have seen many changes, the most important from following the closure of Bullock Hospital. This led to positive changes for people who have a learning disability. People are now supported in a person-centred manner and are encouraged to have an independent life as much as possible. It's great to see people thriving.
Hi, my name's Susan Bracefield and I'm the Chief Nursing Officer here in Cornwall and the Isles of Scilly Integrated Care Board. I've been in the NHS for some 36 years and I feel incredibly proud to have had my career in the NHS. I've been part of some of the most intimate times in people's lives, there at birth and there at death, and I've been hugely humbled and privileged by that experience.
My name's Tina Bullock and I work for the healthcare assistant role in NHS. I think the whole of the NHS is rewarding to work for. You get to see all different works of life, all different patients that come in, brightening the patient's day and actually seeing them leave hospital, going home or going on to new places.
My name is Trudy Addington and I am sister here at Helston Community Hospital and have been for nearly 5 years, and I've worked here since 2006 permanently, and I'm very proud to work at this hospital. It's a very lovely hospital, a very high standard of care hospital, and something that I am very proud of is that we passed the reaccreditation for the gold standard framework for end-of-life care. And one of the things that sticks in my mind as a senior nurse is last year we had a patient that was end of life and the progress coordinator managed to bring the relative of that patient to this hospital, and actually it was the patient that came to this hospital that was end of life and the relative was rehabbing, and they were together, managed to get them together, so when she passed the husband was with her. So to me that is a very standout memory for me and something that was facilitated by the ward and we very much was all a part of, all of us, so very proud of that.